Hi, this is the group for resource utilization.
I'm Evelyn.
I'm Crystal.
And my name is Christelle.
And like I said, we're talking about resource utilization. Very different from allocation. The allocation video is somewhere else in this thread, but I just want to clarify the difference. So resource allocation, I like to think is location of the resources. So where it's going out to. Resource utilization is how we're utilizing or using the actual equipment. So allocation, the location where it goes to. Utilization, how it's being used, how it's being implemented. But I'm going to pass it off to Evelyn.
Hi. Today I want to talk about something that doesn't always get much attention but makes a huge difference in the nursing practice. That's the way that we use medical equipment and the supplies. Every catheter, every lift, all the wound dressing, it all matters in the end. If it's used the right way, these tools keep patients safe and help us conserve our resources, but if it's used carelessly, they can create complications we could have prevented. So we're going to first start with urinary catheters. They're really helpful during surgery and like if a patient has urinary retention. The CDC has a guideline for the prevention of CAUTIs, the catheter-associated UTIs that patients get in the hospital. They emphasize using sterile technique, and if you can, remove the catheter whenever possible. Sorry, you guys. Something as simple as reassessing daily and taking it out early. And it can lower the cost, the hospital being the source of having to pay for them because insurance doesn't pay for those.
So insurance doesn't pay for CAUTIs,
Nope.
but hospital pays for CAUTIs?
Yes, so
Yes.
I think it's a lot how much a hospital has to pay.
Wow. Okay.
But yeah, another thing is mechanical lifts. Really every equipment in general in the hospital, but we have heavy patients and they can be very heavy, and it's critical on our backs too. And there is a study published in the BMC Health Service Research in 2023 that found that in public referral hospitals in Ethiopia, many pieces of medical equipment, including lifts that we're talking about, were underutilized.
Oh, wow.
The underuse often comes down to lack of training or poor access with employees.
Right.
But when lifts are shared across units and they're regularly maintained, staff feel confident using them, transfers become safe, smoother, and less stressful.
Good. And our backs are safe. Ooh.
Exactly. And they're being used because they're not used because of the lack of training.
Yeah.
And then also wound care. This is a big one, especially. Not every wound requires the expensive advanced dressing. Sometimes we get ahead of ourselves and we just want to do everything we can to make it better for the patient. But there is also a journal that highlights that many wounds heal just as effectively with simpler, cost-friendly dressings. And you can find that in the International Wound Journal. For more complex wounds, advanced products are essential, but for many patients, the basic supplies can work just as well. Educating patients on wound care at home also makes a huge difference, especially in reducing complications and, preventing hospital visits. We don't want frequent flyers consistently.
Right.
Also, easing strain on the healthcare system in general. So for nurses,
Going off of what Evelyn said in regards to, using this equipment and making sure that we're educating on it, I really want to talk about, how we're using the equipment. So what I mean by that, let's just start off with the fact that the equipment is so underutilized.
Yes.
Evelyn mentioned, a few things about it, but I want to talk about this study done in 2021. It was done by ADOSA, and it just showed that 2 out of 5 pieces of equipment are underutilized. So 2 out of 5 pieces they're just not being used. And the reasons for that were due to lack of training. It also was due to no spare parts. So if something broke off or if there was a malfunction with the button, they couldn't just replace that little piece. They had to replace the whole equipment, the whole
buying
machine.
a new machine.
Yeah.
And then
Whenever it
the
could have
budget goes
been.
cutting budget again.
Yes, and it's,
Wow.
because it seems like such a large problem in that way because they couldn't fix the one spare part. The equipment just gets not used. It just hangs out on the unit. And going further into detail, a study done by Akapor in 2023 showed kind of more of the whys this was occurring. So malfunctioning equipment was one of the number one things that made it so this equipment wasn't being used. The equipment would malfunction because maybe staff was using it wrong, maybe it just wasn't plugged up correctly, and so it would malfunction. And that also goes into poor maintenance. So if equipment isn't maintained properly, it goes bad.
Yeah.
It's, you know, if you're not making sure that things are cut off all the way, if you're not making sure things are charged all the way and you're just kind of letting it be, if it's not maintained well, it's not going to have longevity. So going into those kinds of things, just make sure that with your equipment you know how to use it. If you don't know how to use it, ask a friend. Also, make sure to report if there's any issues with equipment. So it might be that a screen's not showing up, it might be a lever or a button is loose. Go ahead and report that, because the sooner you report it, the sooner hopefully the issue can get tackled. We can't really do much about the actual cost of the equipment. So our best use is just make sure you're using the equipment properly.
Take care of it.
Take care of it, yes, take care of the equipment, and make sure you're just reporting any kinds of issues you're having with it. And I want to pass it off to Christelle.
Well, regarding like if back to you, just in case you have like new equipment, I think it's better for unit to like implement like education before they start using it.
Yes.
Yes.
Okay, so I'm here. I'm going to talk about the utilizing stuff when the units are understaffed. Unfortunately, under some circumstances, short staffing really happens in healthcare. With short staffing, we know it can place extra stress on the staff and impact safety. So whenever unit is understaffed, we need to implement a plan.
Yes.
Like, what kind of plan? Like, for example, the charge nurse from the previous shift, they can reach out additional support from float team. They can also call some off-duty staff if they want to cover the shortage.
Yes.
Another plan, the charge nurse will assign work buddies. So each nurse and CNA has a partner to lean on.
Yes.
They can help each other turning patient, transferring patient from bed to chair, and maybe covering each other's breaks.
Yes.
That helps. We can also handle delegations. Since the unit is short-staffed, healthcare team members can delegate tasks. Like, for example, the RN can ask the CNAs, like, hey, can you recheck these vitals for this patient for after an hour, because I just give a blood pressure medication. This will help the nurse to reassess the patient's vital signs for the medication's therapeutic effect. When delegating tasks, make sure that you delegate it to the right task, right circumstances, right person, right direction, right supervision, because at the end of the day, the delegated task is under our responsibility and license.
That's true. Yeah.
Yeah, it happened that we all shortage in healthcare is common, but with communication and teamwork, we can make sure that even with fewer hands, our patient continues to receive safe and quality care.
Yes.
Yeah. And going off of your piece about like the rights to delegation, under one of our documents that you will have listed here, it will show the rights in like more detail. So if you guys are interested in just seeing those in more detail, that's in our handout. And any big takeaways from this?
I think that it's not necessarily how we use the equipment, it's how we maintain it.
Yes.
At the end of the day, nurses need to bring attention, evidence-based practice, and efficiency to all the decisions that we make.
Yes.
And that can be with, properly using the equipment, delegating tasks
Right,
to, CNAs, or really anyone that's under your scope of practice.
Yeah. Delegate, be efficient. If you don't know something, ask. Find somebody who does. Find a resource that does, because that helps so much with longevity to equipment and interconnected relationships. And our NCLEX questions are included further down below. So when you guys get a chance, go ahead and look at those, answer them, and hopefully you pass. I hope you pass.
I hope so.
I hope we all pass.
I hope
Thanks,
it shares
guys.
you some good knowledge.
Yes, good knowledge should be shared. Okay, thank you for listening.